joining us and welcome. So if you've been to an essentials class, actually, let me see just if I can see your camera. Don't worry, you don't have to turn it on if you don't have a camera on. How many people have been to an essentials class before? No? So, okay, I see a couple of hands. All right, so I just want to set up some context. So if you've been to one of our essentials recently, post-COVID-19, we started using a different format where we would start with the first part was kind of a shorter presentation followed by discussion. We're going to switch things up today to do more of, as Jennifer said, kind of a panel style of things. So it's going to be more discussion based, and I'm bringing us through. So I'll introduce Sharon Rivette as well as Nia Mostis Sero. I got it right. I think, is that it right? Okay, good. And so we had a conversation when we were preparing this presentation on Saturday, and we were talking about what would be the most important things that somebody should know after a diagnosis of dementia. And so, we identified a couple of key areas that we'll introduce, and we kind of came to the realization that you can go online, you can talk to your doctor, you can receive all these pamphlets and get information about what you're supposed to do, what happens now. But missing from that information is, what is that lived experience? What is it like to encounter this diagnosis that might not be one set point in time the way we often talk about it, but might be a process of several months before you get that diagnosis where you might have some uncertainty. So we want to bring that lived experience to you. And so let's start with Nia. Do you want to start by introducing yourself and kind of where you come at this topic from?
Hi, I'm Nia Mostisero, and I'm 46 years old, and I was diagnosed about 3 years ago with early onset Alzheimer's. A retired Air Force member. I served for about 22 years. I live alone currently, but I do have a 25-year-old son that lives on his own. He's married, has a lovely wife, but I'm just happy to be here today to kind of share my story and what living with dementia looks like, as well as how I was affected when I had the initial diagnosis.
And Sharon?
Yes, I'm Sharon Rivette. I'm the family caregiver specialist on our Caring for the Caregiver team, our program. I've had the opportunity to do that for the last approximately 3 years. What I bring to our table is experiencing caring for members of my family that were dependent on others for their voice or for their total care. And most personally, I guess, or up close 24/7, was my husband that had Alzheimer's for 10 plus years before he passed in 2017. So I continue caregiving for a dear friend of mine's husband. I come alongside her a couple of days a week. So it's still up close and personal in my life. And I'm privileged to have been taught so much through my experience, but also through the educational opportunities that I've had to learn more about the diagnosis.
Thank you so much. So in just a little bit of context of who the heck I am. So my name is Kylie Meyer. I'm a postdoctoral researcher here at Caring for the Caregiver, which means I did my doctoral studies and I learned how to be a researcher, and then I said, I need even more training in family caregiving. And so I come at this from both as a research side, so learning about ways to better support family members. And then on the other hand, I do also have a kind of a personal side, as many of us do, which is my grandmother was diagnosed with dementia just as I was finishing up college, and I just watched this ripple effect about how it affected our entire family. And so I'm really focused on caregiving relationships and family relationships as well. So actually, Jennifer, let me ask, should I share slides or will you be sharing the slides? Whichever you prefer. All right, I'll go ahead and share here. Just a second while I do the little sticks that goes along with switching screen, pardon me. All right. So let me double check before we move forward that everybody can see my screen here, and making sure that it's big enough because I have a really big screen. Sometimes it makes it harder to see. All good? Thumbs up? All right, great. Thank you so much, Carol. All right. So when we got the chance to get together on Saturday, a couple of topics came up. And interestingly, they kind of came up naturally, but actually just 3 days before we had our conversation, our first conversation, Nia, the National Institutes on Aging came out with a pamphlet about what to do after receiving a diagnosis of dementia. And we didn't plan this at all, but actually the topics that we said were most important overlapped with all of those that the NIA said were important. So if you're not familiar, the NIA is the government agency which is responsible for helping to promote research on health related to aging. They have a big focus on dementia right now and have a lot of resources for family members. So we'll point you toward those as well as that specific resource we mentioned at the end. But the topics we thought were most important to talk about were learning about dementia, how important it is to learn about this condition after the diagnosis, making plans for the future, seeking out support, not just support in terms of community resources, but also thinking about more informal sources of support, how to put together your healthcare team, and really, really important, how to advocate for yourself and for your family member if you're a caregiver. So that first topic we talked about was now is the time to learn about dementia. So we talked about how you need to learn about the specific condition because, as you may know, dementia is kind of this umbrella term, which means that there's a lot of different types of dementia. So you could have Alzheimer's disease, Lewy bodies dementia, Parkinson's sometimes has dementia involved, as well as that progression, because what the disease looks like at one particular time may change. So I want to turn to both Sharon and Nia to talk about when you got this diagnosis, did you know what dementia was, and why was it important to learn what specific kind of dementia that you had?
I had previous experience with dementia on a limited basis, but fully understanding it as an umbrella term and the different types of dementia, I did not know that. We were given a very broad diagnosis and nothing else was offered to us in the office as we were dismissed from our appointment. And I think that's where so often people are dropped in between the cracks and they leave, go home, and they have that wonder of every question that comes to their mind with whatever little bit or a lot they know of dementia. So I had to seek it out on my own. I knew that I need to understand it better for myself to be the best caregiver I could. And it was always ongoing learning. What does this mean? What does it look like today? Not what can it look like 5 years from now or even 2 years from now, but what does it look like today, and how do I apply that information to my caregiving and also preparing me to talk to others?
Yes, my neurologist, when I was diagnosed, he basically gave me 2 to 5 years to live. And he told me to get in touch with the Alzheimer's Association, as well as watch the movie Still Alice. And he also told me to get my affairs in order, but he didn't really go over what it's going to look like. I had to do a lot of that research on my own.
And Nia, when we were talking, you had a really interesting point because your grandmother also had, was it Alzheimer's disease specifically or dementia? I can't recall, but you said, I think you mentioned that when you received that diagnosis, your mind went to her. I want to see what that was like.
Well, my grandmother was actually diagnosed after I was diagnosed because we don't, in the African-American community, we don't really, I feel like we wait until it's late stages to go to the doctor. I was very fortunate in that I have a military background. I have a military medical background, so that I was able to recognize many changes in my behaviors and in the things that I was doing. I was able to recognize that something was wrong, but I received my diagnosis before my grandmother received hers.
And that's another great point, how there's different things that might encourage you to receive a diagnosis or not. And I brought that up actually because I think a lot of people have the experience of they might imagine a family member who had a diagnosis and imagine, okay, this is what it's going to look like, and yet dementia looks different on everybody. So that's the snowflake. So just like there's no two snowflakes that are exactly alike, there's no two cases of dementia that are exactly alike. And I see Mabel's hand.
Yeah, I want to ask Nia, first of all, thank you for just presenting this, because I have to say you're an awesome role model, and your bravery to just talk about this for me is very touching. But I do want to know, when you said that you were knowing some changes, did you also see before, after you were diagnosed, was it your grandmother taking the step to be diagnosed, or did somebody assist her to get diagnosed? And how old is your grandma, just out of curiosity?
My aunts and uncles facilitated her getting diagnosed, because of so many things that she was doing. She's hiding money around the house in different places. You know, she's forgetting how old we are. And I mean, there was just so many different telltale signs of late stages. But she's 86.
Well, since you've said that, I just have to tell you that I was told that I had to take my mom from a cousin who came to visit, who hadn't seen my parents in a long time. And she's a speech pathologist, and she had worked with Alzheimer's. And she's the one that told me, you need to go take your mom, in spite of the fact that I had all these strange, what's going on. And my dad, because I guess in a marriage, or when you live with someone, you grow with those behaviors, and you just kind of rub them off as they're getting older or whatever. But not even my dad could see that. And I'm really amazed that the doctor didn't see that. But I think that doctors, I know they have a full plate. They have a full platter of having to diagnose people, illnesses. I think they're so busy with diabetes and cholesterol and blood pressure and heart disease that no one thinks for just a moment, just go ahead and ask about an Alzheimer's test when somebody's saying, well, she's doing this, or she's out of character or something. But anyway, I find that very interesting. And thank you so much for being here with us today.
Oh, it's my pleasure. My pleasure.
When you look on the inside. Oh, sorry. Great. Thank you so much, Mabel, for those questions. And then I want to, this is something that actually came out of some research that I had done when my grandmother was diagnosed. I realized that there was a lot of information out there about what is dementia, some good, some not so good. So I realized it could be hard to prioritize. And so I took an interest in how people go about learning information about how to get support, what is dementia, all those things that you need to know when you receive a diagnosis, but also recognizing from the caregivers I talked to in some of our qualitative research, this could be overwhelming. So just to say, when you were talking about try to learn about the diagnosis, try to learn about the condition, that's really important to know kind of the trajectory, but also recognize that you don't have to open the floodgates. You don't have to know every single thing that there is to know, every detail that you possibly can about this condition, what resources there are, everything else that you could, risks and different interventions you could try. But it is important to, at the very least, kind of prioritize some things. So thinking about, again, that aspect of characterizing the disease, learning about what the condition is and what to expect, trying to plan for the future. So one of the topics we'll talk about, making sure you get that healthcare team in place and knowing where to go to find more information. So you might not be going there right now, but if you need that information, you know where to go. And I think here at Caring for the Caregiver, you have a resource, as well as your local area agency on aging, or ACOG, here in San Antonio. And Sharon, do you have anything that you want to add in terms of the floodgates of information and feeling overwhelmed? Did you experience this?
Well, I did. I was still working full-time in the medical community, so I had access to a lot of information, either to read on my own or professional colleagues that I worked with that could give me even deeper insights. But I think it's important, like you said earlier, not to not to characterize your loved one with everything you've seen or heard of it. And the floodgates is a perfect description. I think don't overwhelm yourself with that, especially when you tend to focus on the length of the disease perhaps and what the last stages might look like. I think it's very important that as we're learning, we learn about characteristics. Of course, we need to have more information for planning, but right now, deal with your loved one as they are, where they are, meet them where they are now, and don't allow your emotions to jump ahead. You know, no one knows the future. We don't know how many days any of us have, and we don't know if we're diagnosed with a diagnosis, if that's going to carry us many years, or something else come along, or God take us home before that. So I think you need to limit what you focus on, and that would be the here and now, and equipping yourself to be the best caregiver, or if you're the one with the diagnosis, to get through the next day or the next month, day by day, after you plan for your future. That's way out there, but let's come back to where you are right now.
Very good, Sharon. I agree.
Good.
And I'm actually, if it's okay, I'm going to jump down a slide, because I think that really goes into another point that we wanted to come across, and I'll come back. So Sharon, Nia, if you see me going off course, it's intentional going off course. But that is too, there's learning about a diagnosis. And when we talked, I think you both encouraged us to separate this out. This is different. Accepting a diagnosis is different from learning about the diagnosis. And I wanted to see if either of you wanted to follow up about what you meant by that.
Accepting the diagnosis took me probably about a year to accept it, because I did go through a mourning period. I went through a deep depression for about a year because I was mourning the future. I was mourning what gifts I had lost or what gifts I'm going to lose. You know, I was mourning the energy that I used to have. But once you accept the diagnosis, then you can go on to start preparing for it. You know, it hits you really, really hard when your doctor tells you you have a terminal disease. You know, there's just no coming back from that. You know, I'm a faithful person. I believe in the Lord. I believe God has a plan. But, you know, I believe that God also put doctors on this earth to help us and to guide us as well. You know, so accepting the diagnosis so that you can prepare is so important. But just understand that there's going to be a time when you're going to be sad about it.
And Sharon, what was that like for you as a caregiver? So you're trying to accept the diagnosis as somebody who's providing care to your husband, but also watching him process this.
Right. It was very difficult for my husband to process this. I think primarily because his father had Alzheimer's, and family didn't know it for many years until he was really almost in the last stages. And so that's what my husband feared. But it's very difficult as you're watching your loved one, knowing that changes are happening. They have been happening. It doesn't just begin when you get a diagnosis. You know, it can be for years that you've seen these changes, and you fear that there's going to be a diagnosis coming. But for me, it wasn't as hard to accept it because I was as familiar with it as I was, but it's still a process to accept it. It's a sad time that you're having to see your future, especially in retirement years. Your retirement years always seem to have some image in your mind or concept of what it will be like. And with a terminal diagnosis of any kind, that changes your plans. So you regroup and make each day count.
That's great. So, and I think we talked about too, we had the slide up, and I think when I first kind of shared a draft of these slides with you, I had these first 2 points up, you know, except that there's going to be a mourning period, except this is a terminal diagnosis. And I think, Sharon, it might have been you who said, but I think we all kind of agreed and said, oh, wait a minute, this is really grim. And I think that kind of fits where, you know, we have to keep in mind, well, life is terminal one, or none of us are getting out of here alive, no matter if you have a diagnosis or, you know, nothing, nothing that you're thinking about just now. But also remembering that life can be purposeful, joyful, meaningful. And I want to ask about, was there a point in time when this hit you, you realized, well, wait a minute, there's still really good stuff here?
Mm-hmm. It was for me.
Yes.
Yes, because your loved one still has great contributions they can share with others. My husband went on teaching. He loved to teach, and he loved to teach in great depth in Bible studies. And so he continued teaching for a long time. And even when he started attending Grace Place during the day for an activity for him, he was still sharing his concern for others and their knowledge of God's love. So he had purpose. His purpose never really waned until the very end. But I still think there's purpose in everything. And so he found joy in sharing his faith with other people and caring about and praying for them. So I encouraged him to continue that. That was his job at Grace Place. That was what he was there for. And
I think that as a person living with dementia after a diagnosis and after you go through the mourning period, it's so important to realize that you do have purpose. Your life is not going to be maybe not the future that you thought it would be, but it's reshaping. Self-care is so important, taking care of yourself and coming up with new interests and being exposed to the Alzheimer's Association, different support groups, learn to play an instrument, learn sign language. There's so much more to life. You actually have time to stop to smell the roses now.
And Nia, what I find so intriguing about your story is that you have this kind of consistent narrative in your story in terms of a commitment to service, where you were in the Air Force serving your country, you were a mother raising her son, or you are a mother raising her son, and then you also have now transitioned that into how do you serve other people who might be dealing with the diagnosis, as well as you're a volunteer for Dementia Friendly.
Yes, I've always had a heart for caring for people. So now I'm just doing it in a different way.
And I'm going to hop back. I'm going to skip around again. Sorry. But there are a couple things going back to when you're learning about dementia that you both said, wait a minute, we have to make sure these points come through, because sometimes we don't always remember. And that first one, actually, I'm going to attribute this to Dr. White here. I think this is something she's been raising over and over, because it seems that in our society, people forget. But memory is not the same thing as intelligence. You can be really, really smart, but still forget things and still experience these symptoms of dementia. So that should affect, we don't want to treat somebody as if they're not as smart because they don't have dementia. It's totally different. And then the second one, I don't know, who would like to speak to this one, this idea about behavioral symptoms, recognizing that, we talk about this idea of blame the disease. When you see behavioral symptoms of dementia, it's not because somebody's trying to do this.
That was a lesson I had to learn. And I think it's a lesson most caregivers learn along the way, because your loved one is ever changing, but at the same time, they're still the same person. You still have the same interaction and expectations, especially if you're a spouse, within home responsibilities. And so behavior, when it's changed, like my husband was always very helpful at home. He initiated helping me, but then as he drew back, and I would try to engage him in involvement with whatever I thought he could be help to me, but also feel like he still was, contributing. He was not always so willing. And when he didn't understand, I didn't understand that he did not have the capability to understand the simple task any longer that had always been a part of activity he enjoyed. So I would challenge him to try to get him to engage in it. But then I realized, difficult for me to realize, the disease was what was causing him to be uncooperative and resistive to participating with an activity. And it was very hard for me to learn that. I think you have a lot of frustration and anxiety, and you get angry and you get impatient because you think that person still has that capability. They walk, they talk the same in most aspects. So that was, and I hear many other caregivers say the same thing. Why won't they do this? It's so simple. They just don't want to. But the disease is what's driving their want to. It changes the ability to process step 1, 2, 3, how to set a table or take the trash to the trash can. The firing is just not there.
And just in case, so in case you don't know what behavioral symptoms are, I think probably most people do, but just in case, these are those things that we see, behaviors, perceptions, things that are disrupting somebody's ability to maybe engage in the world around them. Could include things like wandering, hallucinations at times. So there are things to be aware of that could be just driven by changes in the brain. So it's a great point, Sharon. And Nia, you had a really interesting perspective, and you've probably had to explain this to so many people when you describe early onset, but you said your progression on the disease is not the same as your age. So do you want to explain what you mean by that?
Well, I'm experiencing this firsthand because my outside doesn't match my inside. You know, I look a little bit younger than 46, but also 46 is young to have Alzheimer's, so they say. So my point is that it's not an old person's disease. It is changes in the brain. It's brain atrophy that starts years and years before a person even, you know, starts really thinking about, do I have a brain disease or do I have Alzheimer's or something like that? You have things going on. And for me, like I'm a younger person, I'm young onset, but that doesn't mean that at 50, I won't be in late stages. Mm-hmm. You know? So, you know, God willing, this will be a slow progressing disease, but we just have to remember that we have to take care of ourselves and be aware of these behavioral and, you know, cognitive changes and things like that, because it doesn't start in your 80s. It actually starts decades probably before your 80s.
Mm-hmm. Kylie, can I add something on the behavior that I thought you were bringing up there with Nia? And the behavior and the wandering is important. We experienced that on one occasion, but the hallucinations or delusions that come, I wasn't prepared for. And so I challenged my husband that he was making these things up, and we had always valued truth in our relationship. And in general, you know, you don't make something and you only state it if it's true. You don't want to embellish it and make it a wholly different story. But he began having delusional, he didn't have hallucinations, but he had very in-depth delusions that I was challenging. And I did not know at first that it was the disease. But Nia, I think you had mentioned having this problem already. And
yes, I have nighttime hallucinations and I hear voices. You know, they don't tell me to do anything, but I just hear voices. So that's why my doctor thinks that I possibly have Lewy bodies that just haven't shown up in the PET scan yet. And it's hard, you know, I had to, my system with dealing with those are, if my dog isn't barking, they're not here.
Oh, that was good. Okay.
You know, there's not an intruder. So it's scary and it scares me to death. You know, when I see people in my room or I see somebody, you know, standing at the door or a little girl sitting down or something, when I see those things, it scares me to death. But I do know that if Sophie's not barking, then they're not there.
What a clever strategy.
Mm-hmm.
And I think the other thing with behavioral symptoms, so one, I'm going to plug our Learning Skills Together course. If you are a caregiver, think about joining that one. And we talk a bit about learning how to manage behavioral symptoms. So I think I want to mention, so there's some behaviors, if you haven't experienced these yet, where you want to quote unquote, manage them because this could be putting somebody's safety at risk. There are other times you see behavioral symptoms where they're harmless, maybe management, you don't really need to do anything. Nia, if it's okay, you mentioned you have a special relationship with birds. Is it okay to raise that?
Yeah, I in the daytimes that I would see birds. Sometimes I'm terrified of birds except hummingbirds. I love hummingbirds, but other birds terrify me. But I noticed years ago, I'd be swatting because I see a bird coming at my head or something like that. And my friends, whoever I was talking to, would be like, "What are you doing?" So this started years ago.
Thank you so much for sharing that and sharing something so personal. The other part that we talked about, so Nia, when you first received this diagnosis, your doctor said, it didn't give you much explanation on the disease, but said, just go watch Still Alice. This is your homework. And this started a conversation we had about how you can learn about the disease, not just through going to the Alzheimer's Association, learning about the symptoms, but art as a way to learn. And I wanted to see if Nia or Sharon, if you could comment on what kind of role art plays in learning about what this disease is with it.
Well, when I watched the movie Still Alice, it was like looking in a mirror. And if nobody has watched that movie, I highly recommend you watch the movie Still Alice. The actress did an excellent job of portraying early stages and through the progression and experience of Alzheimer's. For me, music is my muse. I love music, and I may not be able to remember what I ate for breakfast or what I did the day before, but I can remember songs from years ago. I can remember all the lyrics. So I think that art, music, I think that they are wonderful outlets for us to exercise the other parts of the brain that may not be affected.
My husband derives so much pleasure from music also, of all eras. He just really enjoyed it. But he also enjoyed, and was advice of one of his doctors, actually when he had cardiac problems diagnosed, was to watch funny movies. And so he enjoyed watching anything from cartoons to, maybe an old Laurel and Hardy or more current comedy movies he didn't think were very funny. And they are a very different type of comedy than we had many. But if there was something he could laugh at, it was just like therapy. So that's another form of art that entertains us, and laughter is a great medicine, and music, yes. Oh, thank you, Jennifer. I see Jennifer's given us a great website there.
Oh, great.
Yes.
And so, yeah, just there's these different ways of knowing. So music as a therapy, music as a way of building understanding. So we have Still Alice. We also have, I want to kind of highlight this one here. If you see the gentleman in the cowboy hat, this was a presenter at the 2020, sorry, it was a year ago, and yet it feels like 10 years ago, given what 2020 entailed. But this was Clifton Jansky, if you're familiar with him. He's a country music singer. He shared a song with us at this conference about his friend who had dementia. And so if you do get a chance and you don't mind shedding a few tears, this one I think is a really moving way to think about and relate to having somebody in your life who's living with dementia. And then back to, we see too few pieces of art like this, but people who are living with dementia, of course, are producers of art as well. And one person who's done this is Greg O'Brien, who was an investigative journalist, or is an investigative journalist, this time investigating kind of his internal life of living with dementia. And he wrote the book on Pluto, which is this very interesting autobiographical memoir about his experience of living with dementia, but also growing up and watching his mother live with this illness. So that could be something else to consider looking at. And then this is just to bring in a more visual art form, a photo series of a child caregiver who was assisting her mom in the late stages of dementia. I see Jennifer's also shared our Grace Notes Community Choir, which is a really, really great way to spend a Friday where you get to sing. And I think it's still being led by our music therapist, right?
Yes.
Yeah. Wonderful. So some options there. All right, and then I'm gonna walk through these really quick just because you have access to these after, but I know there's good sources of information and some less good sources of information when you go online. And so I just wanted to share some places you could go to learn about dementia. So one of them, of course, the Essentials of Caregiving course. So you're here, you found us, yay! But there are some other folks we want to credit as well. So the Alzheimer's Association has a really good training page. They have multiple types of courses that they've curated over time on different topics, including their 101 course. The National Institutes on Aging has put together a number of resources, especially infographics. If you just need quick and easy information, or if you need to send a link to explain something to somebody, they would be a great resource. WellMed Charitable Foundation, our neighbors up the street, they have their Caregiver SOS program, as well as the Mayo Clinic has some detailed information. And Nia said this was a site that you frequented when you were still learning about what is dementia.
Yes.
And let's see, just for the sake of time, I'm going to hop over to our next topic, which we're only going to touch on briefly because we do cover this in more detail in another one of our Essentials of Caregiving course, but that is document your wishes for finances and health. So you might not be able to, when you get a diagnosis of dementia, you have to recognize that, or you'd have to recognize for your loved one, depending on what role you're in. That person may not be able to make decisions about their health and their finances for forever. So you have to get these things in writing, make sure you know what those wishes are for yourself or for your loved one. And so I'm just going to blow up this infographic, one of those great NIH infographics, and just kind of encourage you to check it out on your own. But they give advice of start discussion early, create documents, review plans, and there's a link to this resource here, but I wanted to give you a quick walkthrough of it so you would hopefully be encouraged to go check it out after, and then of course join us for our legal and financial planning session of Essentials. But that's a lot of blah blah from me, and I want to hear again more about the lived experience of getting this all in order. And Nia, you had a really interesting experience where you said recently you thought you were good to go in this area and then realized, uh-oh, there might be something else I need to consider.
Yes, I saw a lawyer and I got together tons of powers of attorneys, my will. I thought I did estate planning pretty well, and I probably did, but I just can't remember everything that I put in place those years ago. So I'm going to see another elder law attorney, Carol Bursch, I believe her name is. I'm going to be seeing her soon to go over my documents. I think it's just so important, especially with me being single, to have everything in place. I didn't realize that powers of attorneys die with the person. There are so many things that I wasn't educated on. And it's just so important. And when you have dementia, the most important thing to remember is that even though it may be a slow progressing or it might be fast progressing, you're not going to be as sharp as you are today. So don't wait.
Your circumstances for you or your loved one can change so suddenly. And if you don't have the legal documents current, we had all our documents also done in the past. I thought we were all current and we were fine. But as my husband was losing capacity, I realized what responsibility lied on myself, and everything we ever owned or invested or saved was in both of our names. Well, that was going to be a real problem for me to protect that, but provide for him at the same time. So I also sought out the counsel of Carol Burch, the elder law attorney. And there are others in town, but I just have had a lot of personal experience with her, and she was able to guide me. And yes, I was definitely in need of changes, and the timing was critical for us because he was almost at the point that he did not have capacity to legally sign any documents. So the window of opportunity is shrinks as time goes on. So do not delay. It is a cost to it. It's not free, but it's invaluable to you, and you want to get the correct advice. That's why, even though Nia is not a senior citizen, she's talking about elder law attorney, because they are the most knowledgeable about these end of life and living decisions, so that they are legal and will stand up in a court of law if they had to. Medical power of attorneys, etc.
Thank you so much. So precisely, and you put it very, very, very well, in that, you know, you don't know how long you can rely on somebody's capacity to make this decision. And thank you for raising the point. We call them elder law attorneys, but that doesn't necessarily mean that just because, you know, if you have younger onset dementia, this might be a good resource for you as well. So thank you for putting that so clearly. Next, we talked too about seeking out support from others. And in particular, we talked about seeking out support from people who had walked in those shoes, whether it was from somebody who is living with this condition or from another caregiver. And I wanted to see if Nia and Sharon, if you could comment on why is it that it can be, because we know social support is so good for you, right? It's good for you to be connected and to feel loved and cared for. But this is a certain kind of support where you're seeking out support from people who know what's going on. And I wanted to see, why is that support so important after a diagnosis?
Well, there are such responsibilities laid on your shoulder when it's you single, as Nia is, with her diagnosis and so many decisions to be made, and the uncertainty of tomorrow. But for caregivers, the same. You have, or spouses or adult children caring for parents. We already have busy lives. We already have a lot we're committed to and maybe involved in, and then all of a sudden you have legal and financial decisions to be made, or just dealing with the daily frustrations. So when you have connection with others, and they don't have to be people you know, I want to emphasize that, because support groups are made up. I think the first time maybe all of us who've ever attended, we walk into a room of strangers. You might know one person in the group, and you've walked in there with a very heavy heart and so much you want to hear and you like to share. But with me, I didn't share much at all. My first experience, my first attendance was just stating my name, my husband's, and that he came to Grace Place. That's where I went for my support group. I didn't share any details. It was just an emotional hurdle I had to really jump over to go in the first place. But I realized the help, the support that was there from not just seeing you're not alone, others are going through this, but suggestions of what they're trying at home for challenging behaviors or opportunities with other support systems in the area gave me huge help.
And as a person living with dementia, it was so, when I got connected with the Alzheimer's Association, it was so, I exhaled, because there were people that were like me. Your friends are wonderful, your family is wonderful, and they're always going to see the best in you. They're always going to encourage you, but there's things that you just can't express to your family and friends about how you're feeling, about the disappointment in yourself, the feelings of being lost and being lonely and regrets because you can't do the things that you can do that you used to be able to do. So the support from people that are like you is so important. It's so important.
And Nia, you look around for some different support groups. So not just you have the Alzheimer's Association here in San Antonio, but you also mentioned Facebook groups that you're a part of.
Yes, I'm a part of Memory Warriors. I love it. There's people from the UK, there's people from all over the globe. And I'm finding, because my neurologist, he only has a handful of us that are in our 40s that have dementia, but across the world, there are lots of us that are challenged in our 40s and early 50s. And I'm also in a Black Dementia Minds group where that was even more wonderful because people actually look like me. And, you know, I hate the fact that we are struggling with this disease, but we're also thriving with this disease as well. So it's wonderful. It can give you a whole nother lease on life when you are surrounded with people that know your struggles and know that, you know, we can also thrive with this thing.
So well said. Absolutely. And then this fits into a different area. So you have the people that you're reaching out to who may be going through a similar thing. And sometimes that's people who are in your current network, but you also, there's this experience of telling people, your friends and family who are already in your network. And I thought this was interesting. You both mentioned on Saturday about, you know, we want to talk about the reactions, what to expect when you tell people. And Nia, you said you had this interesting reaction from people, which was they weren't altogether surprised. And I wanted to see what that was like.
My son wasn't surprised. He was surprised, but he had seen changes in my behaviors and things that I'd been doing over the years. So, you know, that, and then I had some friends that I guess they're no longer friends, but, you know, they said, oh, you know, you used to talk to yourself and you used to see things, but we just thought, you know, she's crazy. So that was something that really bothered me. And it was a shock that, you know, people around you, they know you and they're watching you and they understand, they may not understand what you're going through, but it may not be that much of a shock. It may not be that much of a shock.
And then on the other hand, there's this other end of things, which is denial. And Sharon, did you have anybody in your life who, when you told them, they said, nah, no, that's not, it's, no, your husband doesn't have dementia. It's just, you know, a normal part of aging. You know, it's minor memory slips. Did you have that experience?
We did have that experience with a lot of people who knew him, but wasn't as up close and personal as maybe our inner circle of friends were. But because he looked great. He had a great personality. He was always happy to see people and positive, encouraging words. And he physically looked great. His health in other areas was really bad also, but he didn't present that when he was out with others. So some denied it. Some family members thought, oh yeah, you know, so-and-so in the family had that. We know what that's about, but they really didn't know what that was about. So I think it's very helpful that you try to minimally, you know, drop some lines of truth of what the diagnosis is and what it is not, as you're telling them. You know, you're not going to hold a seminar on it, but a lot of times people that hear, whether it's family or friends, pull away because they don't know how to treat you from then on. They think you're different and they should treat you differently, and that's totally the opposite of what is true.
Yes, I've had one friend, a longtime friend, that told me that he just kind of was going to pull away because he wanted to remember me the way that I was. He didn't want to know what was going to happen. Mm-hmm. So I haven't really spoken to him. But then you also have some people, friends and family, that are I have my best friend Tundra, I have Deborah, I have Monica, I have my son, I have people in my life that are there for me, and they will lift me up when I'm feeling confused or if I'm down on myself. You know, some people will fall away, but then you also have a core of people that will stand by you and understand.
Mm-hmm.
Yes. Ashley, Nia, I want to say something to you. This is Mabel Brown. I just want to say that now that you're talking about, or that we're looking at what the reactions are, I have to tell you that right now I have a reaction about you, and it's not a denial. It's just, I'm in shock because you carry yourself so well. And just listening,
I have a lot of notes.
Well, listen, I have notes too. but I just listening to you, even if you have your notes, it's the fact that you're carrying yourself so well. And so even a person that might, for my first time meeting you, and you are actually talking about it, I have to admit that I have like a little shock, but I'm over it, but I'm okay with it. But I just have a little bit of shock, but I'm so happy to meet you anyway.
I'm happy to meet you too. You know, I always get that because my outside doesn't match my insides. But, you know, I went to school, I have several degrees, and that's kind of how I knew that something was wrong, because I had started failing courses. I just started messing up at work. You know, my last year in the Air Force, they probably bounced me around to a few different places, you know, and, you know, it's taken me years to realize that maybe it wasn't them, it was me, because I was having some struggles and I was having some problems keeping up with my tasks and my troops. But it's wonderful. I could talk to people all day. This is wonderful. But, you know, coming up with tasks and doing things and being organized, stuff like that, I don't have the capacity anymore.
Do you mind me asking, are you on any kind of medication that is now like the current one that, because, you know, I read the Alzheimer's faithfully, the emails that they send me, and they talk about new medications and breakthroughs. And I'd like to know, are you helping yourself carry on with, you know, medications that you're being introduced to try?
Yes, well, I'm on Namenda and Exelon. I'm on both of those because I have brain fog pretty bad, but it's working out better. The Namenda is helping with the brain fog, but there's one drug my neurologist told me that new drug that we're just waiting on that will actually probably help with the progression that we're waiting on. So I just, you know, I'm doing better on the 2 meds that I'm on right now. This is probably the best that I've been since I was diagnosed.
And
Very interesting.
And I'm going to step in, Mabel. And I think that goes to show it's you know, the stuff we learn in kindergarten. You can't judge a book by its cover, right? Which is, you know, what we think about dementia. And I think this goes really well with Nia, what she said. You know, people think that, you know, look at me and they assume, well, like, this person couldn't have dementia because she's younger. Dementia is an older person's disease. And we just know that, again, going back to that snowflake, there's no 2 cases that look the same. And even within an individual, we know things change day to day. So there's no such person as the average, right? And I do actually, you know, do I want it to, I want to see, double check before we walk away on this point, was this idea of some people stand by you and others fall away. And I want to see how you cope with that. Did the sources of support that you found online, talking to other people going through the same things, were those sources of support able to replace those that had left, or what was that like? I'm sorry, just asking for a little more detail, I guess, on this point.
Well, for my husband, we didn't really have friends fall away. He had a family member that tended to do that. And later I was told, well, it was just so hard to see him. And I thought, it was hard for you. It was very hard for him not seeing you. And it would have helped him, and it would have made it easier, I think, if that individual had come around and been supportive. And for friends who tend to fall away, I think you're missing an opportunity, because your friend has not changed, and they still need you. And you probably still need them as a friend. You'll learn from them as they walk through a journey of dementia and Alzheimer's. And being alongside someone is a great gift to give them.
And then I think sometimes too, we do have those instances where friends and family just don't know, they don't understand, and it's just they've never heard of this condition, or maybe they have some preconceived notions about what it means to be living with dementia. And so we talked a little bit about the importance of education. So, you know, there's a lot of things online nowadays to help people learn about what is dementia. So you can, of course, explain your own experience, as we're so grateful that Nia is. There's also a lot of creative, you know, things that you could do. So you could send somebody go watch Still Alice. There's a novella out of the University of Southern California. So they kind of created a story-based way of building understanding. So that might be a way to tell other people about what it means to be living with dementia. And also, you know, not everybody learns in the same way. So explaining what this is to children can be tricky too. So there are some resources for kids to help them understand what's going on with their family member who's living with a diagnosis of dementia. Are there any other resources, Nia or Sharon, that you think should be shared, or how you help to educate those people around you about what this condition is?
Well, I've urged them to participate with our programming so that they can learn the basics, but to go online and find many different sources that are out there and just look it up and learn of the disease. We know so much about cancer when we used not to talk about that, but in whispers about someone. But as we've learned, there's remission and there's different stages, and no two patients look alike there as they're going through that. So I point them, and the Alzheimer's Association website has so many links that they can open a brochure and what does dementia look like and what are the 10 warning signs, etc., how to communicate with someone with dementia. And I think that is a big one right there, how to communicate. So the friends and family members that feel awkward and uncertain what to say and how to behave, they can feel more confident if they'll learn about how to communicate with that friend or loved one again.
I just want to say something about that, because it is true that, you know, people do fall away, but I think the way that I took the news and I had to go through the mourning stage, somebody that socially knew my mom or something, it's almost like my mom had leprosy or something, or she was contagious. And it's not that that person didn't want to try to find out about her. I think sometimes there's that stigma of, oh, well, you know, it's almost like kind of putting away that person and saying, okay, they're gone now. I'm not going to be able to communicate with them. And I'm just saying it because I have in mind a neighbor that she used to always talk to my mom, and now it's like, oh, okay, yeah, just call me if you need me, or, you know, but there isn't that wanting to learn because it's not their family member. It's now a friend that they could let go easily. So it's not easy to push someone that information, even with family. And I also just saw it recently with a cousin, her nephew that was so close to her and loved her so much. And he came to visit for the first time, and he was so distant to my mom. It was almost sad because my mom was having a moment of reasoning and, hi, how are you? And he was, oh, fine, thank you. And it was kind of like, all right. And then he just kind of looked at her like kids do on a special ed, or, you know, those kids that are bedridden or whatever, and they go by and they just look at them and then they just keep on going in the hallway. That's the way some family are, and friends too.
And Mabel, you were in special education, right?
I was in ESL, and I also worked in the office at a high school. So I saw a lot of, that, you know, if kids had special needs. I used to see the way students would stare at them, and some of them would be polite to open a door, but it was almost kind of like, I don't want to touch them. You know, I'm not going to help them move. You know, it's almost like somebody's contagious. And I think it's the fact that that's the way we live. There's almost like a stigma because those students are put away in a special room. And so I think that, you know, adds more to it. The 1 year that I taught Spanish at the high school that they pulled me in to teach, for Christmas, I made sure that my students made decorations, Christmas decorations and all the holidays, and we would go and sing to the kids that were bedridden or in wheelchairs, because I felt that there had to be a break in that stigma somehow. They needed to know that these were fellow students that would be sharing their graduation year.
Well, and I think, sorry, I must have been mixing you. Now I remember who I was talking to, who is, we have multiple people who are part of our caregiver community who are in education. And so we're so fortunate. But I bring up that point because I think this is a plug for Dementia Friendly, which is we do have this unnecessary stigma in our culture. And I think one way that we can start to break through that is by education, modeling how you can, you know, communicate with somebody who's living with dementia, no matter what stage that they're in. So I think sometimes, you know, I think that your point, Mabel, about how unfortunately in the past we had this idea of separate the person who's different, separate the person who's different. That didn't help us in any way. We're all of us, whether it's dementia or I have really bad psoriasis, so sometimes my skin gets all messed up. All of us usually have something going on. And so if we could just accept some of these things and treat each other, you know, and recognize our personhood at the same time, and that's getting a little bit pie in the sky, but I think that's the idea behind the dementia friendly movement. And actually, Nia, do you mind putting that in better terms than I am? What is dementia friendly and what is the purpose of this movement?
The dementia friendly movement is to just sort of normalize the fact that people have these special needs and being able to provide it to them, be it, you know, understanding that you may have to talk slow or you may have to assist someone. Dementia friendly is just understanding and just letting go of the stigma that, you know, these people, that we're lepers, or that because we have purpose and we're a part of society, but we might need just a little bit of help. So it's facilitating that little bit of extra help that those with dementia may need.
I think it's helping to convey to others to put themselves in that person's shoes. They're concerned about themselves or catching it or not knowing what to say, but the empathy of how does this individual who lives with these disabilities perceive your behavior, that folks don't want to get up close to them. Consider their loneliness when, like your mother, Mabel, that the friend or the nephew no longer wants to be friends. She's wondering, where did they go? Why have they abandoned me? What did I do wrong? I thought I had a friend in them. My husband was like that with his brother, his only brother, and he just pulled away so hard. And it was very painful to my husband, but at the same time, it was because that other person just couldn't emotionally deal with it. Well, we're better people because we do deal with it. We're better because we get up close and personal, and we touch and we love and we communicate. And we have a relationship with any individual that seems to be out of the norm that other people shy away from. We're better people because we get to know them and love on them.
And I know my mom felt that.
Mabel, I'm going to step in. I'm going to step in, Mabel, because we just have to get through a little bit.
Okay.
So Jennifer has put in a couple of resources here for Dementia Friendly. So if you do want to learn more about the Dementia Friendly movement here in San Antonio and then nationally, please go check out those links. So speaking about educating family, Dementia Friendly America does have some really great videos that break down what does dementia friendly look like in different contexts of our lives. So that could be your friends and family. That could be, you know, your local business too. So definitely check that out. I want to get to our last topic, which I thought was really interesting, which is the focus on building your healthcare team and building the healthcare team that works for you. And so I think the big message that we talked about on Saturday was find a doctor who listens to you. And I want to go to Nia because you had two very different experiences. One doctor, it didn't work out so well, and then you had to go find somebody who did work well with you. I wanted to ask you about those experiences and how did you know you found the right team?
So I was very blessed that I'm in the military system. So my healthcare was pretty much already intact. I have an amazing neurologist that I couldn't have asked for a better neurologist. I mean, the nurses call me, they check on me, they follow up with me, everything's wonderful. But on the VA side of the house, I had a PCM that she asked me a question once and I didn't answer it. It was about a pain or something like that I had, and I answered it, and she it wasn't what I had told her before. And then she began to lecture me on the importance of telling the truth. And I cried and cried because I'm like, I am telling the truth. I just don't remember those pains. I can only speak from right now. So I ended up having to, my best friend helped me write a congressional against her, and I ended up changing PCM. So now my primary care provider is wonderful, but not everyone is equipped to communicate with a dementia patient, because it's not that we are lying, it's just that we legitimately don't recall. And there's blocks of space. There's blocks of space and time that you will lose. It's, you have to have a healthcare provider that is willing to listen to you and to understand your condition.
Thank you so much for painting a picture about what that looks like, because I think we don't always know. Sharon, what about you? Because you had a different experience, right? You had somebody, you were quite fortunate.
Well, we were fortunate. We did have one neurologist that was not a desired neurologist for someone with dementia, Alzheimer's, or had a concern for a caregiver to equip them. But by and large, we were fortunate to have a wonderful neurologist that could pick up on signs that even I was not seeing and diagnose and offer the support that we needed. But he was later a physician that gave me some really hard advice, but I had respected him and how he had cared for us in the earlier years. And so that's valuable if you have that trust in a physician that has your best interest at heart, that you can follow their advice, even though you may not want to. It was hard advice to apply to our lives, but it was the right decision at the time. So a healthcare team is important, and in your doctor's offices, the staff in a physician's office, remember they are part of that team because you deal with them sometimes more than you do with the physician, whether it's the nurse or the receptionist that's taking your call. You want to develop a good relationship with that office. You're going to need them, and you want them to be willing to listen to your concerns when you call and something out of the ordinary has happened that's very alarming to you. You don't want to be passed off because they think you're just, another caller for the day, but they take you seriously.
Yes, my provider, the way that my provider communicates with me is she will say, okay, Nia, so how is your leg doing? And I may say, it's fine. I don't remember anything being wrong with it. She's like, well, we can't trust your memory, but you did have this leg pain about 2 weeks ago. So I'm trusting that it's better now. So you just have to have providers that know how to communicate with you as a patient with dementia.
That is night and day from what you first described in terms of testing you. And I'm so sorry you had that experience. Gosh, it makes my blood boil thinking about that. I also, Nia, you brought up this interesting point about getting the diagnosis, because you were at a stage in your life where if you came in thinking, maybe I'm forgetting things a little more often, dementia wasn't going to be the first thing that somebody thought about in terms of a diagnosis. And you had, and you were high up in the Air Force. And so you said, people kept saying it was stress. And I wanted to see what it was like to kind of advocate for yourself and say, I really think there's something else going on here.
Well, for me, I was so off that I actually thought I had a brain tumor. And for me, having a brain tumor meant that they could take it out and I could go back to being normal, So when and I didn't have to advocate for myself as much because I had an amazing PCM that advocated for me. She sent me to many specialists. She sent me to neurology, neuropsych, endocrinologist, a rheumatologist. She tried to rule out everything because of my age. But when the PET scan and neuropsych came back with Alzheimer's, then we knew we had to, go back to the drawing board because it was something else. But it took quite a few months to see all of the specialists and get everything ruled out. But even before being told that it was stress, that it was my job, I did have to fight to advocate for myself and say, you know what, I think it's something else. I really do think it's something else. But you just have to keep fighting and advocating for yourself until you find that provider that's going to really do an in-depth physical exam on you.
That's so interesting. Thank you for walking us through that experience, because as we said, the diagnosis, it's not that one point in time, it's a process a lot of times. And so I think that leads us to kind of our last topic really, really well. So advocating for yourself, and if you're the caregiver, advocating for yourself and your family member. And so, yeah, you had this really interesting story where you said when you were going through this, you were, I forget if it was a certificate program, but you were in an education program and it wasn't going so well, but you finished it. And I wanted to ask how that worked.
So I was working on, this is part of the reason I knew something was wrong, because I'd been so studious before and I was failing. I was working on a pastoral counseling certification and I was failing 3 of my classes, and I had instructors telling me that I wasn't getting it. And so then I stopped, and then I was diagnosed with Alzheimer's. So after that, then I took months off and was going through my depression, but then I regrouped and I said, you know what? They have accommodations for disability. And I really wanted this certification. I really wanted to prove to myself that I still had a brain that worked. So I got with the school and I asked for the accommodations, and I had to provide them my medical diagnosis paperwork and everything. And sure enough, I was able to finish. I finished and I got the certification, but I had to advocate for myself. I had to do that. And it comes with still wanting purpose and still needing purpose in your life.
Definitely. Nothing is impossible. It's just what are your needs and what's the fit of the environment, and we can change the environment to make things work. And so Sharon, I wanted to ask you, because you come in from a different perspective, which is, did you find yourself having to advocate or ask people to help you maybe change something about the environment or accommodate your husband so he could continue to do things that were important to him and that he enjoyed?
Well, yes.
Oh, sorry, Sharon. I meant to mute myself and I muted you. I'm so sorry.
That's okay, no problem. I did on occasions and just day-to-day interaction once he was, especially going to activity center during the week where he would have interaction with other people, and we ran into some hiccups from his part, not on theirs, and his accepting it and continuing the program he needed. So they were accommodating to what I would tell them. This is our concern. This is what behavior I'm hearing from him afterwards, and they would help address that. So I was his voice in that regard. And then at the end, and when he was in memory care, pardon me, also you have to be the voice for your loved one. You need to monitor their care. You need to monitor how they are doing and be there for them. But we had a special need adult son that was profound IDD and did not have a voice for himself, and he needed the care of others. So I had many years of experience in being his voice and advocating for him, starting out from being a very shy mom and not knowing what to say or what I had the right to say, and learning how important it was that you continue to be their caregiver. Even though you maybe have placed them in someone else's 24/7 care, you are still their caregiver. Never feel that you are abandoning your loved one if they do have to be placed, because you will continue to be their voice. You will continue to make sure their care is adequate or better, and you will not allow neglect or abuse because you are their voice. So be bold, be gracious, and be appreciative, but do not hesitate to advocate.
Definitely.
Awesome.
And oh, go ahead, Nia, please.
Oh no, I love how Sharon said that. I just love how she said
Oh, well,
it.
thank you.
Well, and I'll pick on you both if you don't mind, because I think in our culture too, sometimes as women, we always try to accommodate other people at times. We try not to be the burden or ask too much of other people, if you don't mind me being so general. And so asking for help can sometimes be difficult. And I wanted to, Sharon, I really like how you phrased that, how you had to learn. I have to learn to become bold, for your son first and then your husband. Nia, you were in a leadership position in the Air Force. You were the person giving help for most of your life, raising your son in the Air Force. What was it like to transition to having to ask for a bit more help from other people?
It's still difficult. It's still difficult to ask for help. I put a lot of things in place in my house, and just, I make sure I had a great car with the GPS and things like that, so I wouldn't have to ask for so much help with getting around. But it's been hard, and it's still difficult to ask for help. I ask for the bare minimum, but I do know that I have a support system in place if I need it.
That's great. So people you can turn to when you need to, and building up your muscle of asking for help, practicing using it when you need to. I just want to briefly touch on two more slides because I know we're coming up to the end here. One of the things that we talked about too was when you receive a diagnosis, yes, you may be living with this condition. That doesn't mean that you're going to stop striving to be healthy. You can live very well and promote your health even when you have a diagnosis. So Nia, you said you're on, it's called the Mind Diet, and I was wondering if you could tell us a little bit more about what that is.
Yes, the Mind Diet is basically like eating what they eat in Europe, Mediterranean style. You eat more nuts, you eat a lot of omegas, you eat fish, you kind of stay away from the heavy meats, but you eat more fruits and vegetables, things from the earth. You feed your brain and you feed your heart. Mm-hmm.
That's fantastic. So there are things you can do. And I just wanted to point this resource out. This is from the American Heart Association. So there are resources on the Mind Diet. It's just because it's a little bit newer, the resources aren't quite as clear, and it's, have to do a bit of homework on it. American Heart Association, I just put up this link, has some pretty user-friendly tools. They have an assessment about how you can eat well to protect your heart, which we know protects your brain, as Nia said. And then lastly, I'm just going to hop over to this idea for caregivers. We always talk about, just like when you're on an airplane, you have to put your oxygen mask on first before you assist somebody else. So as a caregiver, you're trying to take care of yourself too, to provide really good care. And so one of the things we encourage here at Caring for the Caregiver is to make sure you do your need to do activities. So your exercise, showering, making sure you're seeing the doctor, but also you're taking on a lot of responsibility. And I think this could actually apply if you're living with a diagnosis, you have your need to do activities. Well, it applies to grad students, it applies to veterans, it applies to anybody. You have your need to do activities, but make sure you're taking time for things that you want to do. So if you're in a stressful situation, this becomes really, really important. Make time, schedule time to go read that book that you want to read, catch up with friends, go gardening, whatever it is that you love to do. And I wonder if Nia or Sharon, do you have any final words on these making sure you make time for you?
Just echo what you said. Ditto. Very important.
And also your faith base, exercise your spiritual base, your faith base, because those intangibles will really, they'll close the gap. They'll bridge the gap between what's ailing you and the pleasure of life. So just exercise your faith muscle.
Definitely. Yes, yes, yes. Lots of things we can be strengthening. And so lastly, I'm going to hand it off to Jennifer, but I do want to say that we do have this resource here from the National Institutes on Health. Excuse me, my San Antonio allergies are catching up. But this is a really good infographic, and there's a link right here. This is just page 1 of 2, so it talks about, learning about the condition, getting regular medical care. And we would add probably from our end, making sure that medical care team is who you want on your team, and finding resources and support and so on. So thank you both, Sharon and Nia, so much for sharing your experiences. I have learned so much from talking to you both the last few days. And I will leave it to you both to see if there's any final words on what we talked about today.
Well, thank you, Kylie, for your kind words. It's been a pleasure to be a part of this today. And I think my final words would be, never give up. Don't wane in the journey you're on with your loved one, but continue to pursue information to be equipped. You're on a journey. Pack your bag with what you're going to need along the way.
And I would probably end with just understand that that dementia is not the same for everyone. And realize that people with dementia, you still have value. Your life may not look the way that you thought it would look, but it could look even better. You still have purpose, you still have life, you still have meaning. Just find those things to make your life easier. Declutter your house, de-stress.
Yes.
Eat well, exercise, and just exercise your faith muscle.